Abdominoplasty or tummy tuck is a very common procedure done in plastic surgery for correcting loose abdominal wall skin and laxicity. The commonest cause for all these problems are repeated pregnancies when the duration between or the interval between the pregnancies is very less. So a lot of women come to me with these complaints, and essentially I offer them a tummy tuck procedure. So who is an ideal candidate for a tummy tuck? Any person who has lax anterior abdominal wall, who has protruding anterior abdominal wall, and who has a lot of loose skin on their tummy is an ideal candidate for a tummy tuck. If this candidate is doing it after pregnancies, then we would advise her to finish her family and then go for this procedure, which is essentially permanent. And another pregnancy in the future may again derail the abdomen. So it's better to finish the pregnancies before undergoing a tummy tuck procedure. A tummy tuck can be combined with many procedures. Sometimes when you need a hysterectomy or a tubectomy, you can always combine that with a tummy tuck. Now, with the advent of the mommy makeover surgery, a tummy tuck is generally combined with liposuction in the thighs and buttocks, liposuction for the upper abdomen, liposuction for arms can also be combined with a tummy tuck. Many patients, as a sequence to the mommy makeover, would like a tummy tuck to be done along with breast implants or mastopexy or even a breast reduction surgery. So this new terminology which has come is a sequence of all these operations put together and is termed as a mommy makeover surgery. So you can safely combine a tummy tuck with other procedures also. A lot of people who want to undergo a tummy tuck are very concerned about the downtime that is required. Downtime is basically the rest period. For a tummy tuck, a 1 week downtime is more than enough. But for 90% of the healing to occur, it takes 3 weeks, and 100% healing takes 3 months. It's very similar to a cesarean section. The duration of stay in the hospital varies from individual to individual. Sometimes we do a mini tuck where you don't need to elevate the abdomen totally, and in those cases we can discharge the patient in the evening. But for a conventional tummy tuck, which is commonly done, the discharge would generally be after 2 days. So essentially you have to stay in the hospital for 2 nights for total recovery, and about 1 week rest is all that you require for this tummy tuck. Afterwards, 2 weeks of careful movements at home or even slow movements while driving a car or going to the office is all that you require for adequate healing of this procedure. A lot of people are very concerned whether a tummy tuck or an abdominoplasty is safe to undergo. Commonly they tell me that I've got 2 kids at home, I've got a young family who require my help, and is it safe to undergo these procedures? It is perfectly safe. An abdominoplasty is as safe as a cesarean section. The only drawback is that whether it is necessary or not, and because it's not 100% necessary, that's probably why everyone asks their surgeon whether it's safe. When you undergo a cesarean, you never ask whether it's safe or not because it's 100% necessary. So that's the difference why people always ask me whether an abdominoplasty is safe or not, and it is very safe. There are a few complications which can arise, and essentially those are related to wound healing, because when you remove a certain amount of skin and abdominal wall and you bring both the edges together, there might be a certain amount of stretch in the opposite direction when you move or when you walk. So the only complication that may arise with a tummy tuck is issues pertaining to wound healing. These are not major things, These issues can heal with a delay of probably about a week or 10 days. Apart from that, there are no major complications that can be associated with this operation. Now, on the day of surgery, you may get very worried about what is the procedure that's going to be involved, what type of anesthesia am I given, and all these things are generally discussed by me with you in the consultation room itself. And we come to a schedule or a plan. I would be telling you about what to expect and what not to expect, some of which I'm going to tell you now. We normally perform a tummy tuck surgery early in the morning. So you would need to come into the hospital with about 7 or 8 hours of fasting. Once the anesthesia is given, which normally is a regional anesthesia, either spinal or epidural, but in some cases we do give general anesthesia, especially when we are combining a tummy tuck with either a breast augmentation or a mastopexy. Once the anesthesia is done, there are essentially 3 components in the operation. Number 1 is elevating the panniculus from the underlying muscle. Once we elevate the panniculus, we find the muscles which have been separated and we bring them together and suture them with a non-absorbable suture. That itself will give the tightness and decrease the waist diameter. Once that is done, the third component of the operation is trimming the excess skin and fat. We do that by bringing the panniculus down and removing the excess skin and fat. After that, another component is transposition of the umbilicus in the correct position and correct shape. So these are the components of the tummy tuck operation. It takes about 5 hours to do, and once it is done, we leave some drains, abdominal drains in place. These drains generally are kept so that excess fluid or secretion from the tissues is collected in that drain, and also the negative suction within the drain provides good adherence of the flap to the underlying muscles. Drains are generally kept till about 5 days. Now, what is the post-operative care that you normally need to do after a tummy tuck? It's very simple. The very next day you will be mobilized, you will be taken for a walk around the hospital, and you also have to walk with a forward bend. This is because we are removing a significant amount of skin and fat, and both the edges are approximated together. So any stretch will cause pain. So we ask you to walk with a forward bend. The drains are in place, and you'd be on a normal diet the very next day itself. We would discharge you either the very next day or the day after that. That is 2 nights in the hospital. And once you go home, you can do all activities at home, but in a restricted manner. Whenever you're walking, forward bend is important for about 5 to 6 days. For the drain removal, you have to come back to the hospital on the 5th or 6th day. And once we remove the drain, you will be given a pressure garment which you have to wear 24/7. The pressure garment is actually what helps in compressing the abdomen and helps in healing also. And it also gives you a good shape, especially for the areas which have been liposucked. Majority of the tummy tucks are combined with liposuction, a procedure which is known as lipo-abdominoplasty, especially for the flanks, that is the love handles, and the upper abdomen. This is basically done to give you a better shape and also to give a natural appearance to the abdominoplasty result. An abdominoplasty or tummy tuck is an extremely safe procedure which is time tested. Once done, the results are permanent and give a gratifying result to the patient. I hope with this video that you have understood the procedure. However, if you have any doubts regarding the same, please feel free to contact me either by email, WhatsApp, or just give me a call. Best would be to walk into the clinic whenever you're free so that I could actually discuss the procedure in depth with you and give you more light on whatever you want. Thank you.